So, my name is Erica Alamani, and my project examined the effects of visual activity schedules on task behavior during structured in-home instruction. So, children with autism often display reduced on-task behaviors during structured activities, which can impact their learning. Visual activity schedules have been commonly used to increase predictability and independence. However, it is always important to evaluate their effectiveness for each individual learner. So the purpose of this study was to evaluate the effectiveness of a visual activity schedule on increasing on-task behavior for a 5-year-old client with autism who is receiving in-home ABA services. The participant was a 5-year-old female, and she was displaying difficulty maintaining engagement with activities. She would display behaviors such as moving from her seat, disengaging with the materials, and not following instructions within 3 seconds. So increasing her on-task behavior was important to support her future learning and independence. So for this study, I used an AB reversal design to evaluate the intervention. On-task behavior was measured using partial interval recording during 5-minute sessions, which were broken up into 10 30-second intervals. During baseline, sessions were conducted without any visual supports or prompting, and then during the intervention phase, visual supports were used as well as prompting and reinforcement for task completion. So during the initial baseline phase, on-task behavior was low and variable, and when we introduced the visual activity schedules, on-task behavior increased and showed an upward trend. So when we removed that intervention, we did see that the behavior decreased back down to baseline levels, and when the intervention was reintroduced for the final time, the on-task behavior went back up. So that demonstrates a functional relationship between these visual activity schedules and increased on-task behavior. So these findings did show that visual activity schedules can be an effective and practical intervention for improving engagement and independence. And this type of intervention can be applied across different settings and tasks to support learning. Some limitations that I came across was that there was only one participant. There was a short amount of time in each phase and a short time in general for the entire study. And there were some day-to-day variables in the in-home setting that affected the data collection. So in the future, I would definitely say adding more participants, extending the phases and the overall length of the study itself, and it would be really good to add measures like treatment fidelity and inter-observer agreement analysis just to back up the data even further. So overall, this project demonstrated that a simple visual support can meaningfully improve on-task behavior and support learning outcomes in the long run. Thank you.